thanks so much for joining us. What do you make of this recent research and what are you experiencing in terms of GP pressures?
Well, good morning. We're not surprised at our Royal College to read this report from the GMC. We've been talking about workforce problems for decades now, and of course, the problem that we're seeing right across the NHS is that there really just aren't enough healthcare workers. We're talking doctors, we're talking nurses as well, and it's a real problem for all of us. In general practice, we're actually losing GPs faster than they're coming in, through training, because of the burnout from a really excessively high workload, and what is now being called the moral distress of doctors who feel that they're not able to deliver the kind of care for patients that patients deserve and that they've been trained to give.
Is this endangering patient safety? This research showed that 62% of GPs found it difficult to provide sufficient patient care. How dangerous is it getting for patients?
Well, it's so difficult to say, isn't it? I think that, when you are seeing 50 to 60 to 70 people in a day, and you have less than 10 minutes per person, there is a danger that you won't hear everything that the patient wants to tell you, that you'll miss something because you're in a hurry, and that, patients will have to come back again and again before they get what they need. And that's an awful waste of resources as well as terrible for patients.
What needs to change?
We need more doctors. Of course we do. We need a
And
lot more GPs.
how do you do that? How do you do that?
Well, the government has definitely been increasing the number of trainees coming through into general practice. But what it hasn't done quite so successfully is working on retention schemes to keep some of the more experienced GPs working in practice, because we're actually losing doctors faster than we're gaining them. And doctors are leaving at all stages of their careers. They're leaving in their 20s, their 30s, their 40s, their 50s, and it's all for a variety of different reasons. So we need a national push for a retention programme to encourage GPs to stay in work.
I'd like to ask you about another subject, if I may, Professor, while we have you on. We have a report from Ireland this morning over the diabetes drug Ozempic, which is being used by people who don't have diabetes to help with weight loss. Are you concerned about that?
No, it all depends on how it's being used, because it's now been licensed by NICE, the National Institute for Clinical Excellence, since March, I believe, for weight loss in particular groups of patients. So these are patients who are obese, with a BMI of over 35, and also health-related condition, related to their weight. It isn't a wonder drug, but there is good evidence that if it's used properly alongside a weight-reducing diet and a lot of support, that people can lose significant amounts of weight. And certainly in diabetes, it can result in a normalisation of blood sugars as the weight comes down.
It's received a lot of PR on social media from influencers and celebrities who've used the drug. Is it possible to obtain without a prescription?
People are buying it privately online. You can get almost anything you want online, can't you? But you have to be very, very aware of the dangers, because you don't always know what you're getting. So you need to make sure that if you are buying this privately, that it is properly licensed, that it's approved, from an organisation approved by CQC, the Care Quality Commission, or the General Pharmaceutical Council. And I would advise people to be very careful. And it is really not licensed for people who are of normal or slightly raised weight. This is really for people who are very overweight. That's what it's been licensed for.
And are there any side effects that people need to be aware of?
It works by making you feel full so that you then eat less. And it can make you feel very sick indeed. And as it's usually given as a once a week injection, once it's in you, you can't scoop it out again. So you're then stuck with it until it wears off.
OK, thanks very much indeed. It's fascinating insight. Professor Kamila Hawthorne, thank you for joining us.
Thank you.